Brought to you through the regional support of First 5 Fresno County, First 5 Tulare County, and First 5 Madera County. Because it's all about the kids.
Hello, I'm Juanita Stevenson. Welcome to 0 to 5 in 30 minutes. All parents want to do their best to make sure their child is happy and healthy. So it's no wonder that some families are now banking cord blood as a means of treating disease. But is it right for your family? Let's take a look.
You want me to make a flower? Okay.
Make a flower for me.
I'll make a flower for Palmer.
Jennifer Hayden is the mother of little Palmer. She banked his cord blood with a private company based in Arizona.
And when you're going to be a new mom, you do a lot of research into everything. And I just figured if I could prevent or help treat any kind of disease that might be detected early on in my child, that I kind of owed it to myself and him to give him the best possible care.
Cord blood is the blood that remains in the umbilical cord and placenta following birth and after the cord is cut. Dr. Jeffrey Thomas with the Central Valley OB/GYN Medical Group explains the banking is independent of your hospital and physician.
The patient contacts a cord blood company and they send a kit which the patient brings to the hospital.
Dr. Thomas says the process is pretty simple.
There's not much in the way of risk. Once the baby's delivered and the cord has been clamped before the deliveries or the placenta is delivered, a needle is placed into the umbilical cord and blood is collected and packaged as the manufacturer of the kit recommends, and then it's shipped.
The doctor has to collect the sample, and then there's a courier that is outside waiting to take it right away.
The cord blood is then frozen for proper storage. Cord blood is routinely discarded with the placenta and umbilical cord, but a baby's cord blood is a valuable source of stem cells.
Cord blood banking is kind of a new frontier in science. We're moving away from surgery and medications to try to treat conditions to replacing some of the body's natural tissues.
According to cord blood banking companies, cord blood can be used to treat more than 70 diseases, including leukemias, lymphomas, and severe anemias.
For certain stages of diabetes, so we do have some diabetes in the family.
Stem cells from the donor are transplanted into the child who is ill, and then those cells go on to manufacture healthy new blood cells, boosting the child's blood-producing abilities and their immune system. But it's important to know children aren't always able to use their own cord blood.
And what a lot of people don't realize is some of the diseases that are advertised as being treated with stem cells. Unfortunately, if your child has those genetic problems, they're not able to receive their own blood back. And the true benefit down the road could be receiving blood from a public blood bank who does not have that same genetic or metabolic disease or disorder.
The American Academy of Pediatrics encourages families to donate their newborn's cord blood to public cord blood banks if accessible in their area for use by others in need. Dr. Thomas recommends that you sit down with your doctor to discuss the best option for your family.
I would say that if you have a known inherited disease in your family and you are considering donating, that you should have that dialogue with your pediatrician and your OB/GYN to try to make an informed decision as to whether or not this could benefit you.
Jennifer tells us she did her research and is glad she banked her son's blood.
It's a very good idea to have that option available to you. You might never use it, which is one of those things. Say, do you want to pay for something that you might never use? But if it doesn't cost me very much money, if it doesn't break the bank, of course I'm gonna do it.
The average price to collect and process the cord blood is about $2,000 to $3,000, followed by maintenance fees.
It's about $125 a year per year.
There is no telling what the future holds for stem cell research and its role in exciting medical advances. But in the meantime, it's important to do some research before making your decision.
Brought to you through the regional support of First 5 Fresno County, First 5 Tulare County, and First 5 Madera County. Because it's all about the kids.